We have been busy at the faculty as 9 support workers from lots of different organisations within the care system for the support worker project, and it was to look at organisations and the support workers within them, finding them and also finding key stakeholders within the organisation to help promote the Health Education England framework that's been written. It's called the Allied Health Professions Support Worker Competency, Education and Career Development Framework.
There's 2 kind of main parts of the framework. The first part is obviously the standardisation in which the level the support workers are working in their competencies, and that will protect support workers from working outside of their remit, also like protecting allied health professional roles and what their remit is as well. And the second part is to aid better career progression pathways for AHP support workers. Yeah, it's just about opening those doors for people really.
At the moment there is no standardised progression for support workers, which I think is quite disheartening to lots of people.
We have each gone into respective organisations and created drop-ins for the support workers to come and talk to us.
The fact that we were there as fellow support workers made them feel really, really valued, and sometimes it was the first time for a long time that they've really been listened to and really felt heard. We've also raised awareness of the apprenticeship. A lot of people didn't know about apprenticeships that were available in the health service. One of the things I've noticed when I've gone out to the drop-in sessions is that there is an awful lot of talent out there, a lot of untapped talent. There's a voice coming through from support workers that are really, really keen to improve and develop and really want to give patients the best that they can possibly give.
We have reached out to hundreds of support workers. We organised a survey to go out to them. We have had an enormous response to the survey, so we've had over 200 responses back.
Got lots of feedback, lots of constructive feedback to move forward with, to how we can try and pave the way for a better future.
It was quite shocking, I think, in a way, to know that there are a lot of support workers who want to develop. They don't know how to develop, they don't know what is there for them.
It's important to have a clear pathway, because otherwise you've got nowhere to go in your career, and it might be seen that we don't want careers as support workers, but we do. We want progression. It can be disheartening to hear that people feel they have hit a dead end, and it's disheartening for me because I feel the same, which is not good for the NHS. And what I've also learned is that everyone I've spoken to loves working for the NHS. So we don't want to leave because of the job itself, but it's just that lack of progression that seems to be causing this desire to go.
So the benefits for organisations to take up the framework, I think, would be to enable their staff to feel that they can progress. They build their workforce, creating highly skilled staff that actually are kind of at the foundation of their team, to enable the qualified members of staff to deliver their practice as well.
I guess probably that the organisations, what they're going to get out of the framework is potentially maybe a happier workforce, better staff retention, people that are more enthusiastic about their job because they're seeing that they've got that career progression and they've got that voice and they've got that recognition of their work. We all know that a lot of roles at the moment are quite understaffed, and people, unfortunately are leaving the NHS to go into different roles. So, by protecting and enabling the workforce to progress, then that's going to enhance the workforce, I guess. Yeah.
Well, I would hope that all the trusts are going to implement the framework. It's a good tool. I feel that if they did, their retention of staff would be much better.
It would be good for retention and recruitment as well. If we can show that we can progress and grow our staff, then it's the place to be, it's the place to work.
I think that organisations will be using people to their full potential, which in turn will make patient care so much better, enhanced, safer, and I think also it will take the pressure off our qualified colleagues.
The legacy of the project, I would see it that we have started a change movement for the unregistered support workers for allied health professionals. And it's the start of something really exciting that can help for the future. And we leave completing our part of a project that will continue in a different manner, but while still continuing the movement for support workers to have a voice within their organisations.